What happened after 5 o'clock?
Well, this is where the deadly combination of all that fluid backed up into our lungs. So, we're not getting oxygenation from the right side, and fluid is backing up in the right side of the heart. And then the left side of the heart is working so hard to pump blood out against a really high blood pressure. It was catastrophic. She just had a cardiopulmonary collapse.
And do you have an opinion as to whether or not that is why her blood pressure goes down to 0?
Her heart stopped.
And is that the condition called asystole?
Yes, you have no blood pressure when your heart's not pumping.
Okay. And that's right when the code was called.
Right.
Okay. Do you have an opinion as to whether or not Dr. Angus is cared that you have said falls below the standard of care during the day of the 25th that he was treating her, caused or contributed to making her heart stop beating?
Yes, it did.
To a reasonable medical certainty or probability?
Yes.
Okay. So the code was called, the code team responded, and it appears that it took some 10 or 11 minutes to revive her where she was without oxygen during that period of time.
Yeah.
What is the probable effect of being without oxygen for 10 to 11 minutes?
Brain damage.
And do you have an opinion within reasonable medical certainty as to whether or not Dr. Angus's conduct that led to the cardiopulmonary failure and a code that lasted 10 to 11 minutes and had systole with no heart rate was caused by his conduct to a reasonable medical certainty and probability?
Yes, it was.
And if you assume that Shannon Trabue now has permanent anoxic brain damage, can you tell us whether or not it is likely to a reasonable medical certainty and probability that that code event is what caused it?
Yes.
Now, could this tragedy have been prevented?
Yes, it could have.
How could it have been prevented?
Well, if they paid attention to I's and O's, when Dr. Simonson was called and told there was decreased urine output, she would have known that the solution wasn't to give extra fluid. Having given that extra fluid, if she had told Dr. Angus the next morning, look, this patient's had 5 liters in and almost no urine out, you got to watch this, then Dr. Angus could have been warned for the day. Dr. Angus could have looked back at the records himself and said, this isn't decent urine output after all because she's 5, 6, 7 liters ahead. I have to watch fluids carefully. The worst part is when called to the bed of a patient like this with preeclampsia and sudden hypoxia, especially when the nurse has already heard fluid in the lungs. What we tell our residents to do is if you think it could be pulmonary edema, that's the first thing on your list, give Lasix right then. You don't have to wait for a chest x-ray. Just give Lasix. It costs a couple bucks. If they're not fluid overloaded, the Lasix won't hurt them. If they are fluid overloaded, that could save their life. You don't have to send the patient down for a chest x-ray before you get Lasix. And that simple treatment might have made all the difference.